an Italian construction company called Rizzani Germany's Hospital Engineering, and Bergam Invest of Sweden. Unfortunately, because of the international border closures due to the coronavirus pandemic, Mr. Claudio and Mr. Marco De Ecker, shareholders of Rizzani De Ecker, cannot be present, but they are really eager to visit Ghana as soon as possible. We are a group of companies led by Rizzani De Ecker, a contractor that was established in Italy more than 100 years ago and has a turnover exceeding €1 billion per year. They've constructed over 10 million square meters in projects and construction activities. We have branches in over 30 countries globally, and we have extensive experience in delivering hospital facilities and medical projects around the world. In fact, we've built 13 in the last 5 years, with a capacity in excess of 3,500 beds and at a cost of circa €750 million. Our specialisation, globalisation, capacity and flexibility are all keys to our ongoing success, and we want to share and collaborate with Ghana so that everybody benefits from our experience. We have successfully delivered hundreds of projects globally. As you are aware, Ghana and Italy have a long-standing relationship that spans decades, and this once again is an example of the continuous and fruitful cooperation between our countries. We have two partners. One, Hospital Engineering. Hospital Engineering GmbH is a German company specialising in delivering quality hospital projects, medical equipment, and the expertise that entails. Hospital Engineering Ghana has had a strong presence here in Ghana. It's been here for well over 50 years, and we're involved in the development of the 37 military hospital and also the Confonoce Teaching Hospital in Kumasi. The other part of the consortium is Bergam Invest. Bergam Invest is a Swedish EPC contractor with a focus on turnkey projects. Bergam is strongly supported by the international banks and the Swedish ECA, namely EKN, and this provides us long-term competitive financing for projects that have significant human developmental impacts, like this maternity block project, which we are extremely proud to be involved in. As I said, we are honoured to participate in this project and are excited by the opportunity that has presented itself, enabling us to build this maternity, gynaecology and in vitro fertilisation block at this famous Korlebu Teaching Hospital. The project is anticipated to be completed within 3 years and executed respecting Ghanaian traditions, the citizens of Ghana, the Ghanaian context, and obviously the environment. During the execution of this project, and it's fundamental for us as a European consortium, we will be utilising local companies, workforce, technicians, and the pool of talent and expertise you already got in Ghana. We are hoping that we will positively contribute to the economy and benefits of Ghana, respecting the safety and quality international standards. Finally, I'd like to thank the Government of Ghana, especially the Minister of Finance and the Ministry of Health, who have shown diligence and perseverance, the respective embassies who are continually supporting us, and also the financial institutions who, like us, believe and continue in the constant investments in Africa, specifically Ghana. And I would also like to thank Amber Key, who's especially been providing and helping us over the last year or so. So once again, I'd like to thank you all, and thanks again. Thank you.
Many thanks to you, Iwan Gwine from Hedebi JV, for your very brief remarks. This morning, Mr. President, it's my pleasure to introduce to you the contractor for the Obstetrics and Gynaecology Center, Vamed Engineering GmbH, represented by Mr. Albert Taki, the branch manager.
Good morning. Vamed Engineering is the contractor for the Urology Nephrology Center of Excellency. Let me do that correction. His Excellency, the President Nana Addo Akufo-Addo, Minister of Health Honorable Kweku Agyeman-Manu, Chairman of the Board and Management of the Korle-Bu Teaching Hospital, the Chief Executive Officer, Korle-Bu Teaching Hospital, all protocols observed. Vamed is recognized internationally as one of the leading companies in healthcare sector. Vamed provides a complete package of services for every type of healthcare facility: teaching hospitals, specialist clinic, rehabilitation centers, thermal spas, health resorts. The range of service that Vamed provides covers the entire healthcare value chain, from project development, financing, planning, construction, to total operational biomedical engineering and facility management. Everything comes from one source. That is what Vamed does. In Ghana, Vamed has completed over 40 healthcare facilities, ranging from teaching hospitals, the Tamale Teaching Hospital Phase 2, district hospitals, polyclinics all across the country, over 35 of them since the year 2000. The company is noted for completing its projects on schedule and assures the government and the people of Ghana the Urology and Nephrology Center of Excellency will not be different. In 30 months, we will deliver a turnkey project. We are looking forward to partner the government of Ghana on the Agenda 88. We are waiting for His Excellency. Thank you.
Many thanks to you, Mr. Albert Taki, for your remarks. This morning, Mr. President, Nime Name, distinguished ladies and gentlemen, it's my pleasure to invite to tell us in depth about these two amazing projects, the Minister of Health of the Republic, the Honorable Kweku Agyeman-Manu. Please welcome him warmly.
Your Excellency, the President of the Republic of Ghana, Nana Addo Akufo-Addo, the aspiring Member of Parliament, who seems to have already secured his seat. They call him, what's the name again? Shiache. He's got it already. It's our prayer. Board chair and members of the board, the chief executive officer, and all your heads of department and management of Korle-Bu, representatives of the diplomatic corps and our development partners, distinguished ladies and gentlemen, Nime Name, I am very delighted to be with the President this morning to officially cut the sword for the construction of the Korle-Bu maternity and gynecological block and the Urology and Nephrology Center. I am very delighted because a vision the President shared with me is materializing today. The road towards achieving this vision has been bumpy, but in the midst of all the bumpiness, we have today landed safely to cut the sword for yet another groundbreaking project. To talk about vision, let me give you this example. The Urology and Nephrology Center had been on the drawing board for some time now under a funding arrangement that was never seeing the light of day. When the government took over the reins of governance in 2017, we looked at the options available in terms of funding, but we had to change the structure. And today, what has been on the drawing board since 2009 is now becoming a reality. I joined when we were talking about PPP arrangements. They have done numbers. And I very much remember one meeting we had at Cleaver House. That day, it's like I had moved from the position of health to finance. And I was engaging in even advising as to what parameters we should use and how we can make the project bankable in terms of the statistical numbers we had to put in the drawing board. Later, I had to call Mr. Taki, who was leading VAMED at the time, and told him that why don't you guys go look for funding and let us stop all these challenges we're having with the PPP. There was a time that VAMED thought that they couldn't recoup in the number of years they were going to borrow the money for, and so government will have to be topping them up on their monthly repayments and so many things. And I believe those discussions have yielded what we are seeing this morning. It is on record that the nation is losing over 1,200 people to kidney and urogenital diseases every year. My figure might not be right. I just talked to the CEO, and he says, Minister, Kolebu alone, I said no, nationwide. He says it is likely we can have even more. Again, a lot of resources are sunk into flying people outside the shores of Ghana for treatment of acute nephrology cases, and it is only fair that this project is done, and done very well, to save lives and save resources of our country. So, Excellency, there is still a long way to go in achieving the desired specialist facilities that the country deserves. But government is not resting on its oars. We have come a long way in building our healthcare infrastructure through successive governments, but the gap remains huge and still needs to be filled. As you may be aware, the government's delivery program will see the completion of 11 healthcare facilities by close of the year at the following locations within the country: Sumenya, Weta in the Volta region, Sola to Nakalba, Bupe and Tolong. Bekwai District Hospital will be completed. Tepa is about to be completed. Nsoko will be completed. Trifopras will be completed. Kumaku will be completed. And from now, we're even getting some place ready for case management for coronavirus. So all these projects, Mr. President, you will have to commission them before the elections. We will take you there. To further address the infrastructure deficit of the health sector, government has secured funding to implement a number of projects before close of the year again, 3 of which are the ones we are starting today. After this morning doing the maternity block in Kolebu and the nephrology center in Kolebu, we are taking the president again to Katso for the reconstruction of the La hospital, which had failed structural integrity test, and it was becoming very dangerous for anybody to either attend for services or even sit in there and work. The building has been pulled down as we speak, and the president will do shortcutting for the reconstruction of the project this afternoon. We also have outlined construction equipment of some hospitals that I may want to mention here. Again, Mr. President, before the end of the year. The sub-regional hospital at Tema, the reconstruction of the central medical stores, construction and equipping of Shama District Hospital, construction and equipping of trauma hospitals in Enyinem and Obuasi, refurbishment and re-equipping of Enyrensi and Obuasi hospitals again, construction and equipping of accident and emergency center at the Doma Hospital, construction and equipping of Nkranza District Hospital, construction and equipping of 12 new hospitals in the following locations: Jumapo, Kwabin, Nkwetia, Edukrum, Achiasi, Suami, Drobonso, Sabronum, Masun Kwanta, Pedie, Mim, and Pon Katamanso. Your Excellency, we have sourced for funding, and your cabinet has approved, Parliament has approved, and Finance Ministry is working very hard for us to assess, and we are just about tapping money to bring into these projects. That is why the sword cutting we have embarked on. We will do sword cutting for these projects this year, and they will all start. Mr. President, these are not part of the Agenda 88 you are embarking upon to actually get us hospitals in all districts. These are outside. So when we add that one to the 88 you are going to cast out for again, there is no justification why you should not have another 4 years to come and commission the projects you have started. The biggest challenge, however, facing the ministry is the reluctance of prospective health workers to serve in facilities outside the big cities of Accra, Kumasi, and to some extent Takoradi. This problem is further compounded by parents and relatives who come up with several stories hoping to effect changes after postings. Let me serve notice, Mr. President, with your indulgence, that this phenomenon will no longer be countenanced as the country stands the risk of losing out on the achievement of the much talked about universal health coverage. Mr. President, yesterday I had an occasion to ask a very close friend who was coming to me to try to change the posting of relative. And I told him that the president is going to build hospitals across the country. So if our children, our nephews and nieces should all come and work in Kolebu and Ridge, how will we get doctors to go to those places? So I'm working on discouraging all of us who will come and say, they have been posted to OT, but I want to come to Accra. So, President, the sad thing is that close to 82% of all doctors in our country are found in the environs of Accra and Kumasi. And so we have places that I call the one hospital, one doctor syndrome. So the doctors in such facilities are working 24 hours and rest for 365 days a year. They can't even go on leave. Some don't have doctors at all. Government has taken steps to improve the incentive packages for staff posted to the rural and less endowed areas. And I'm encouraging all of us to see ourselves as Ghanaians and work wherever we are posted. You never know where you will need medical help. It is my hope that we will all put our hands to the wheel and drive our health sector growth in the right direction. The inclusion of certain key services in the construction of the Urology and Nephrology Center, as well as the maternity and gynae center, points to a direction where public health facilities will be required to be financially independent of government. A case in point is the IVF Center, which, when managed properly, should be an income-generating activity for the hospital. I therefore task the management of Kolebu to bring up a proposal which will make these facilities sustainable as far as the operational cost and revenue generation is concerned. Last but not the least, the growth of Kolebu has been somehow amorphous, which many of us are not happy about. And I'm tasking management of the hospital to team up with the infrastructure directorate of the ministry and other relevant professional bodies to come up with a master plan for the total redevelopment of our Pioneer Hospital. The construction of these facilities is in fulfillment of the government's commitment to ensure universal health care to all citizens in Ghana, in line with the government's vision under the Sustainable Development Goals. May I thank the contractors, Mrs. Vamed Engineering and Hedebe JV, for the respective roles they played in securing funding for the project. We look forward to a more fruitful engagement as we move into the project delivery phase. Vamed will have a special mention here, looking at the partnership they have fostered with the Ghana government in developing several health facilities over the last 22 years. As the fair moves on to build the Urology and Nephrology Center, it is my hope that they deliver a good product to serve as reference points in the development of specialized facilities in the country, as well as the sub-region. To conclude, Mr. President, may I thank my staff for sticking with the government to deliver quality health care. The government is indeed grateful and looks forward to much better working relationship as we continue to churn out these facilities and the necessary logistics to make your work safer and smoother. I thank you all for your audience.
One more time, let's say thank you to the Honorable Kweku Achimamenu, the Minister of Health. A round of applause. And in 4 years, you're sounding like a doctor already. This morning, he speaks to us as a man who has made it abundantly clear to us that the health of a nation is the wealth of the nation. Would you please make welcome the President of the Republic, Nana Addo Dankwa Akufo-Addo.
Glasses. Good now. Minister for Health, the acting chair and members of the board of directors of the Kolebu Teaching Hospital, the chief executive, management and staff of Kolebu Hospital, chargé d'affaires of the Italian Embassy to Ghana, representatives of financiers of the project, representatives of the contractors, ni Kolegono Manye, Nime, Reverend Father, fellow Ghanaians, ladies and gentlemen. It is good to be back here again at the Kolebu Teaching Hospital, and I'm happy to cut the sword for the construction and equipment of two major facilities, namely a 12-story, 400-bed maternity and gynecological center and a 2-story, 101-bed urology and nephrology center. The commencement of work on these two projects, in addition to the reactivation of construction work on the abandoned 750-bed maternity and children's block at the Komfo-Anokye Teaching Hospital in Kumasi, will significantly reduce maternal and neonatal mortality rates in our country. They are also further testimony to the commitment of government to improve our country's health care infrastructure and move us steadily towards the goal of achieving universal health coverage for all. Kolebu, over its 97 years of existence, has served as a center of excellence in teaching, research, and the provision of high-level specialized healthcare services to Ghanaians and to persons from beyond our shores. This hospital, which is the third largest in sub-Saharan Africa and the leading referral center in the country, is challenged with inadequate infrastructure, equipment, and cutting-edge technology to enable it respond adequately to the ever-increasing demand for its specialist services. Indeed, on my recent visit to Kolebu, when I commissioned the intensive care unit of the National Reconstructive Plastic Surgery and Burn Center for the hospital, I was struck by the poor state of the maternity block. I promised to help remedy the situation, as the current state of the building is not fit for purpose. Today's ceremony is a fulfillment of the pledge I made. Once completed, the facility will contribute to addressing the persistent challenges of high maternal and child health morbidity and mortality in Ghana. It will also help accelerate towards the achievement, our progress towards the achievement of the SDGs, the Sustainable Development Goals, through enhanced access to quality maternal and child health services. Government has secured an amount of 145,220,000 euros from Standard Chartered Bank to cover the cost of the project, with an export credit guarantee from the Swedish Export Credit towards the reconstruction of the maternity block. The project has an insurance cover of some 19 million euros, and it is to be constructed through a joint venture entity known as Hedebi JV. The partners of this group are Rizani De Escher, Bergram, and Hospital Engineering Limited. The 12-story maternity block will have the complete functional package for the delivery of maternal services with the following components: 400-bed capacity, 20 labor delivery rooms, 100-seater waiting area, 26 recovery wards, 18 treatment rooms, 24 consulting rooms, 7 theaters, IVF services, 10-room accommodation for new mothers, 32-seater restaurant with a preparation area, and an emergency unit with its own triage and operating theater. Indeed, upon completion, the center will be the first public facility to deliver IVF services in the country. Ni Kolegono Manye, ladies and gentlemen, I'm also happy to inform you that funding to the tune of 38 million euros has been secured for the turnkey construction of a urology and nephrology center of excellence here at the Kolebu Teaching Hospital. This is being funded by Raiffeisen Bank International AG Limited of Austria, with OEKB Group, again from Austria, providing insurance cover of 4,666,950 euros. The project will be constructed by Vamed Engineering of Austria, and once it is completed, will offer advanced treatment for persons with genitourinary conditions, chronic and acute kidney failures, as well as nephrology services such as kidney transplants. The experience of VAMED in delivering healthcare projects in this country has been outstanding. And with this being the second specialized facility after the cardio center to be built in Kolebu, I'm expectant that an excellent state-of-the-art facility will be constructed for the people of Ghana. The two-story urology and nephrology center will have a 31-suite dialysis station for persons with kidney disorders and 70 beds for genitourinary patients. The center will also provide outpatient services and serve as a resource base to conduct research into urology and nephrology cases. Again, once completed, it will be a game changer for men in this country, especially for those of us above the age of 40 years old. The irony of the matter, I am told, is that at the approval stage in Parliament, it was our female MPs who were at the forefront of pushing for the acceptance of this project. Kolebu to give meaning to medical tourism, services to neighboring countries, and increase its revenue base to expand services. Austria and Italy, European nations which are good friends of Ghana, are projects completed on schedule and on budget. And I urge the contractors and management of the hospital to collaborate effectively in delivering quality projects to the benefit of all Ghanaians. May God bless us all in our homeland, Ghana, and make her great and strong. I thank you for your attention.
Ladies and gentlemen, the President of the Republic, Nana Addo Dankwa Akufo-Addo, a resounding round of applause. It's the first of its in Ghana. Mr. President, ahead of the sword cutting and the planting of the tree, we shall have a photograph first at this side where the contractor will walk through the project, and thereafter you'll be invited to cut the sword. Because of the times we're living in, we shall respectfully just invite the Polikono, Manche, and Manye alone, just the two of you, to join the President when it's time. To this end, ladies and gentlemen, I say we rise as we say. I shall now ask that we all repeat as the President of the Republic, together with the Health Minister, the official parties, take an exclusive photograph, and thereafter So that is
Sami. Obe facing. Obe facing. The camera
dedicated for maternity, one for the gynaecology, so the team and 5 separate teams that are listed off to expedite the development and expand on what we've done at the moment. So, fully modern state of the art, like I say, keep up on and then support there to the 7 theatres. And during discussion, technical that we also integrated with technology, which was successfully done so after negotiations for a while. So we're really excited now to give you a good artist professional. The aesthetics is the finish line. So we're really getting excited. We want to start. We want to do it. So it's a pleasure. Thank you so much.
Yeah, big on this side.
And now the moment we've all been waiting for, where the President of the Republic cuts sword.
Excuse me, we are behind you. We are behind you.
Let's have some song celebration in the background. Has been planted, and by virtue of what we've done here right now at this defining moment in history, ladies and gentlemen, we can confidently say that this mountain we see before us, this old dilapidated building, today we see, we shall see no more. And if you're happy, put your hands together as we celebrate this great day in history.